Welcome, everybody. Thanks for joining us, and thanks for your patience while we straighten out some minor technical details. We'll be letting a few more people in from the Zoom room to the actual presentation. So give us a few more seconds and then we'll get started. Thank you. All right, it looks like we should get started. Welcome everybody to this UIS Community Health Roundtable jointly sponsored webinar related to health in our community during the pandemic. This is the 17th of these in a series that started back in June of 2020. And we're happy to be able to bring these to you. We have a wonderful topic today, overcoming misinformation during the COVID-19 pandemic, mainstream and social media, public health, and outreach to the public and disadvantaged populations. That's a long title, but we have four terrific panelists who are going to be able to navigate our way through all those things and more during the next hour or so. We also have a wonderful moderator, fresh from a turn on the Citizens Club panel this morning, and now here to help us make our way through, and that's Dr. Molly Lamb. Dr. Lamb is the Executive Director of the University of Illinois Springfield Center for State Policy and Leadership. And she has a terrific background in public health herself throughout her career. And so we're lucky to have her to help guide us through this topic. Molly?
Thanks so much, Dr. Stewart, for your kind introduction and framing of the webinar for this afternoon. I'm just delighted to be able to moderate the webinar over our lunch hour, and thank you for all. I think we have about 30 attendees right now, and hopefully more that'll listen after. This is such a critical topic as we've navigated the last 18 months and beyond, really, of the COVID, to be able to learn lessons about communication and information and data, and understanding what we're talking about when we're talking about misinformation and disinformation. I'm really excited to have with us colleagues and our esteemed panelists that have worked really, really diligently and hard during this pandemic. So I first thank them for their efforts and really really communicating and providing solid information to you public, and sharing with us how to differentiate that for you as a public, and to continue to have credible resources in order for you as a public to make more informed decisions. So we have with us Gail O'Neill. She's the director of the Singham County Department of Public Health, and she's worked in public health for 40 years. And I've had the honor to work alongside with her in public health. So thanks for being with us today. Randy Eccles, he's our general manager of NPR Illinois, and it's a great honor and privilege to work with him closely every day as a part of NPR Illinois, part of UIS, and a part of the Center of State Policy and Leadership. And Dr. Katrine Wallace, she's a trained epidemiologist with over 15 years of professional research experience, and she's with the University of Illinois Chicago at the School of Public Health, and as an epidemiologist and adjunct assistant professor of epidemiology. So thanks for being with us. And Dr. Matt Yarnell, he's an engaging leader in healthcare. He's the director of the Office of Community Care at the SIU School of Medicine, and right here in Springfield, and strong partnerships and relationships across the community. So thanks for being with us. We're going to start with Gail. Gail, as a leader in Singham County Department of as a leader in Singham County and a leader of public health for the Singham County Department of Public Health, summarize for us where you would say we stand with the pandemic in our country, and what you predict will happen to COVID with the holidays and cold weather approach. Kind of level set us where we are so everybody can start to frame around where we are in the pandemic, current cases, vaccine, so then we can have a more informed discussion about the criticality of information exchange.
Sure. Well, I wish I could tell you that we were in a lot better shape. We're in better shape than last year, and that's only thanks to vaccinations. A year ago at this time, there weren't vaccinations. They were very close, but the population, our communities, couldn't even begin the work on the, getting the herd all taken care of in our community. So currently the numbers are creeping back up, which is kind of a sad thing just for us to see. We've been seeing, there was times where we were having 20 or 30 positive cases a day. In the last week or so, we've been noticing that they're closer to 60, 70, and 80 cases a day. So that's a little bit alarming. And the age group has kind of changed. It was mostly the elderly before, and now we're seeing children all the way up to people in their 60s, 70s, and 80s. So it's not gone. It's, we're currently under an increase. The whole state is. A month or so ago, there was a rumor that the governor was going to lift our mask mandate. Everybody got excited, and then it must have been a curse, because then our numbers started to rise. So we are in a pretty critical time, it appears. The intensive care rooms are getting crowded again, and we just know that with going inside and having people be in close quarters, and with the holidays, that it's just a cold doesn't fly much anymore. Sinus infection or something. We still need to be cautious about COVID.
Great. Can you also, I think we're at I just did a double check this morning, and are we at am I remembering correctly, a 63% vaccination rate with 2 vaccines, and about a 57 with 1 vaccine. How are we doing with children under 5 now that that's been released and approved?
Sure. Overall, the whole community, we're at 57.28% vaccinated, which is slowly creeping up, and it hasn't gone down and it hasn't stayed stagnant. It's just slow. The youth vaccines, or the pediatric vaccines, we're kind of calling them, the 5 to 11-year-olds, already there's been 9.62% of that age group population that has been vaccinated. So we're happy. We're not the only ones in town doing it. So there's other places. And vaccinating that younger group is a little more challenging. We chose not to do that in a drive-through setting. It's the kids that age are a little more of a challenge. The youth in the ages of 12 to 17, about 48% of them are vaccinated. We're hoping some of that's coming from the schools and coaches and people encouraging the grade and high school students to be vaccinated. Our highest level of vaccinated folks are 65 and older, where that's 89%, almost 90% of them vaccinated. And then the adults 18 to 64, we're at 62.37%. So the numbers are good. They're not as high as we'd like them to be, but we have been so busy lately, either with third doses or booster doses, that we're seeing 200 people a day coming back in for that. We'd slowed down quite a bit, but over the last month, that has greatly increased too. So we're happy to see that.
Well, I know you'll share with us through this conversation this morning how you've been successful. You mean Singham County is in the top 10 counties in Illinois for its vaccination. So that's a huge applause to you and your team and the work of the community. What sources of information has Singham County Department of Public Health relied on, and how did you decide to communicate with the public, especially to the many different audiences that you serve?
Well, the best thing that happened to me as far as communicating with the public is that the county brought on, by about April last year, brought on a media consultant, which was wonderful. And Jeff Wilhite joined the team as a consultant and has subsequently been hired by the county for this role. There is no way the amount of information could have gone out in an efficient and a professional manner as it had without his help. I don't know. I feel like I have a handler, but it's an important position to have. He was really important and integral in working with the big 5 we started out with. The partnerships, and this kind of goes into one of your other questions, but the relationship that we had with Memorial Health and Springfield Clinic and SIU School of Medicine and HSH St. John's and us, there were 5. And in the beginning of this, it was really important to get the message out that we were all in this together. And then we really coordinated our messages every day. We were putting information out, and it would go through this team of the media people from, the consultants in each agency to get the message out in the most understandable way. And then there was times when we would organize a press release or a press conference, and then we'd need to bring in the white coats to add to the magnitude of the situation or to answer questions. So there are many different audiences, and we thought about that seriously when we set up our hotline, to make sure that hotlines and people were had questions answered in a level that they would understand, and tried to get the hotline number out there. We wanted to do appointmenting, but we knew that some people just didn't have the technology ability. So we wanted people to be able to call in or just get online. I think that was really important for us as a team to work together. So I think that was really important. We relied totally, everything we did seemed to be directed by the Illinois Department of Public Health. Generally, we didn't get answers as quick as we were getting requests. So we had a very good medical consultant team, which is still working with us. We met daily on the phones, and we could call them for questions with Dr. Miller, who's the president of our Board of Health, and Don Graham, who's worked in our community for years, Dr. Graham, and then Dr. Vidya Sundaration, who's our medical consultant to the health department and also infectious disease specialist. And they have been invaluable to answer the questions. And I could always say, well, if I don't know this, but I'll check with our doctors and get an answer back. And I think the public appreciated that we had the medical community often on interviews on the radio. Sometimes we'd do it together, Dr. Sundaration and I, to have the medical side and just the one that's more what the average public with my information might understand.
So, when we talk about your successes, I realize that you also identify areas of which there's work to be done. So what do you think are the most common sources of misinformation among our local populations? And beyond just the success that you've just discussed with us, how are you dealing with them and overcoming them in order to achieve the goals and results that we're seeking as a part of this pandemic?
Yeah, that has been the biggest challenge of this pandemic is the misinformation. And I think, we hadn't had a pandemic or a real big public health problem for quite a few years. And in that time, technology snuck in on us. And so information is readily available to people from any source and with any version of the information they want to read. We have a whole lot of people that, have gotten a PhD on Facebook from and COVID, and a lot of the information is good, and they would let us know, well, I saw this, and it gives us an opportunity to look. But sometimes the misinformation, the things that scare people, the unknown is really where some of the problems were. And once it became a real political issue, then you had that playing into it as well. So some of the misinformation, we had early on talked about looking at the surroundings you have when somebody come in. One of the concerns was, if you take this vaccine, you'll become sterile. And we tried to go back to figure out where that was, and had comments that where you had to mix some of the vaccine, it was sterile water or sterile was visible to the public with things that you don't think about, those kind of things, and the concern, conspiracy theorists that were putting chips in people, and people believe this. It would cause infertility, or the vaccine just doesn't work. The vaccine can't work that fast, and something that was pushed through so fast and didn't have the proper studies. Those are tough to overcome. Mm-hmm. And I think in the beginning we were given poor information. This was new, and we really needed to say, and often did, we don't know. We don't know what's happening next. And when people are scared, they're getting sick, and people are dying, I don't know isn't a very comfortable answer. Mm-hmm. Mm-hmm.
Yeah, we had a submitted question upon registration, and I know we're excited to hear from Dr. Yarnall later around, community health workers and using trusted individuals and sources to be able to overcome misinformation, disinformation, inaccurate facts. But from your perspective in leading the public health response in Singham County, what facts do you believe are reassuring to the citizens, to the patients, that the vaccine has been sufficiently researched and is safe?
Well, I think that initially it was people getting the vaccine and not having a reaction that was alarming. Sometimes you would hear about the reactions, but it may not have been from here, or it could be an isolated incident. And, there are side effects to vaccinations, and vaccines aren't 100%, but everybody, forgets that we do that for the flu. It's still not 100%, and we still do it every year. So that, is quite a challenge. And I think there's still questions. There's still people hesitant to take the vaccine and deal with what what's going on or what long-term. After 6 months, or now we're seeing that maybe the vaccine wears off some. That's what the need for boosters is. So, 6 months after your last one, because we're seeing people that are fully vaccinated, done everything right technically, and they're getting infected, some, and the majority have underlying conditions, but the response to that is, see, it doesn't work. We told you it didn't work. So it's just kind of a balance, and it's hard to say, yeah, it may not work on everybody, but it's the best we have. And that's been the story, and it's not popular.
Mm-hmm. Hindsight, we all love it, right? 2020. Right. And, oh, geez, if I would have known this yesterday, I would have said this or communicated it that way. But,
right.
And you've provided a few examples, maybe even the sterile and other, of what's been put in the public and could have done it differently. But in retrospect, should the Sangamon County Department of Public Health have communicated anything differently about COVID than it did?
Well, one of the things, and I should have known better, but I don't know how you change it. You go through trainings, and there's a caution about anytime you give people numbers. But this called for numbers, because it was like not real unless we had numbers, and people testing was meant to make it real. We know that a fear factor only works so long, and we don't want to do that dishonestly, but there is something to be concerned about. So the caution about numbers is some people will watch them. And if there's one thing off, and we put numbers out every day for at least a year. And so we would try to tell people of how many people were positive, how many people were in the hospital, how many had recovered. Because at that time, all we knew was people that had either gotten sick, and either you recover or you die. So that's all the numbers we had. We were hand counting everyone to make sure that they weren't duplicates and trying to make it correct. But sometimes the numbers just don't balance it. It straightens out the next day. And once you put numbers out there, you have to live by them. And so we're still doing it. But it's, and some people want, and then the state might change the way it reports things, and there could be computer glitches. And so relying on numbers, which people want to get, and we wanted to just have a picture and be pretty transparent. It's a challenging thing to explain when things change. So I think in hindsight, I don't know how we get messaging out, but to not be so reliant on the numbers. Or I don't even know how to do them differently. We've gotten better as the years gone by, and there's more people. But when you're talking about a small population that's going to explode, that's something to consider right away.
Mm-hmm. Well, great. Well, thank you, Gail.
You're welcome.
We'll be circling back at the end here.
Absolutely.
And I'll pull you all panelists back together, but we're going to pass the baton to Dr. Wallace. Dr.
Great.
Wallace, thanks for being with us today.
Thank you so much for inviting me. This is an honor. I appreciate it.
Would you mind telling the audience a little bit about your background and how you have used your skills to make an impact during the pandemic?
Yeah, so as you said at the beginning, I'm an epidemiologist. I got my PhD at University of Illinois, and I just basically on social media, I never meant to be a social media influencer. I teach classes at UIC. So my science communication was mostly in the classroom before the pandemic, but I downloaded the apps kind of during the lockdown, just like everybody else did, because I was bored and I was just kind of scrolling at home. And in addition to seeing videos of people's dogs and their food, I was also seeing, unfortunately, a lot of COVID-19 misinformation. And as an epidemiologist, it hurt my soul. So I had to kind of come on and set the record straight. So that's what I did. And we got almost 21 months later, I'm still doing it.
This is fantastic. It's just amazing to know modalities that have existed and that have, perspectives around them, and to be able to utilize in a positive, productive way. We're using these terms, misinformation and disinformation. Can you explain to us what that actually means for the public?
Yeah, so a lot of people use misinformation and disinformation kind of interchangeably, but they are inherently different. They both involve the sharing of false information or false data, but they differ in their intents and purposes. So for example, they're both misinformation. Anything that's sharing false information is misinformation. But where it becomes disinformation is when there's some kind of intent behind it to mislead people. So for example, there's an organization called the Center for Countering Digital Hate that I work with on different projects, and they have identified that 2/3 of the false information on social media really comes down to 12 individuals, which they call the disinformation dozen. And these people actively create disinformation. And then what happens is these people have large followings on social media, millions of followers, and then their followers will take those memes that they create, or the, skepticism about the vaccine, and then share those widely. And the people who create these memes, that every one of their social media profiles has a link in their bio where if someone clicks on it, they're selling products. So really this proliferation of false information benefits certain people. So it's very, it's organized, and it's terrible because as Gail was saying before me, it is a huge impact to public health because misinformation is now a risk factor for more disease and more death. So it's really a co-epidemic.
Thank you. When referred to as a science communicator, what role do you have, and how has that evolved during the pandemic? Along with, how have you gained credibility and trust in your journey?
Yeah, so I like to, when I kind of describe myself, I like to say that, science communicators aren't really newscasters or educators, but we're both educating and newscasting, because we are giving kind of up to the minute information. But what my job is versus like what the media would do is I don't just give one disservice I feel like the media has done is that every data point that comes out, they sort of report it in isolation, like, oh, the vaccine's only 39% effective. This is what Israel is saying. And then they move to the weather, and then people are like, oh, the vaccine doesn't work, and then they ignore this body of evidence that we have now showing that the vaccines are effective, and that, the difference between different vaccine effectiveness numbers has to do with testing. Like, there's a testing behavior component to those numbers, which isn't really, so the nuance behind the numbers is not really shared in the media, because it's really not their job, right? So it's led people to really not really trust the vaccines, because we're seeing these numbers not in context, I guess. So my job, I feel like, is to kind of say like, okay, we have this new data point. This is how it changes what we already knew. Because it is important, as Gail was saying, is that we have an evolving dynamic body of data, which has been good and bad, right? Because people don't believe science because it keeps changing. And I think that people are not used to seeing the public health process unfolding in front of them, right? These conversations usually happen between scientists kind of behind closed doors, not wide open for everybody to be following along with, right? So it's good that people are more aware of public health, that people are more engaged in the process. But on the other hand, it also has been confusing for people, I think.
I was wondering if you'd provide the audience just a little snapshot of your projects, if you wouldn't mind sharing. So
Sure. So I do social media science communication. And like I said, this was never something that I intended or set out to do. It just sort of grew organically. I started a TikTok page just to counter misinformation on TikTok. And then it was really just for like my own friends and family at first. And then my videos started getting more and more popular. And now it's just kind of grown to this crazy thing. And then I've branched out into other social media networks, Instagram, Facebook, YouTube, and Twitter. But I'm going to show my TikTok because it's kind of like where it all started. And it's also my biggest platform. So this is my page. I don't know if anybody's familiar with TikTok. It's basically just like short videos that you can do that, they're like from anywhere from 15 seconds to 3 minutes. So it depends on what I'm talking about, how long my video is going to be. But this has been a very good exercise in brevity for me because I'm used to having a whole class period to talk about these things, right? So, so basically I just go through and lately, you know, it's been kind of hard lately to, you know, I feel like we're at a point now in the pandemic where whoever is not vaccinated now is really, they have their heels dug in, right? Because we have so much evidence now showing that the vaccines are effective. So I've sort of pivoted a little bit from just presenting data to now just kind of exposing anti-vaccine rhetoric and how it is mostly just logical fallacies. So I've been taking every day, I take a different kind of standpoint and then show how it's a logical fallacy, like it's cherry picking, or it's a straw man argument, or it's appeal to emotion, or it's a coordinated disinformation campaign, or a slippery slope fallacy. And this has been fun and people have really liked it. And I really think this is kind of helping to break through that extra wall that we have with these people that are still kind of dug in.
Mm-hmm. Yeah, this is fantastic. And, you know, what's also, you know, communicating information is also, the brevity is so key, right? There's so much happening and people are just inundated that if you can be catchy and brief and really have that main primary takeaway, this is fantastic.
Yeah, and people's attention spans on social media are really short. And that's a really important thing when we talk about misinformation, is that the things that tend to go viral are things that are sensational viral content, which misinformation falls under that heading. So you have to kind of be able to kind of like use music, and like I have ones where I'm like roller skating, or I'm you have to try to catch attention, because in this online environment, misinformation does tend to go more viral than real information, and that's been part of the problem, right?
Mm-hmm. I wanted to, you and I shared conversation prior to today, and this is a good, you know, bridge between you and Randy, if you will. But the Science News Cycle PhD Comics authored this comic, this infographic, and your local epidemiologist, I think, posted as a part of her Facebook page this past week. But this really kind of shows you the cycle, if you will, and how where science and evidence starts and how it can evolve. So I just wanted to really ask you for your reaction to this comic, and then it'll be a good bridge to Randy too, as he's representing public media.
Yeah, so this, I have a lot of people shared this on there. A lot of science communicators shared this, and I do love it because it shows exactly what happens. Like everything that kind of hits any research that comes out, whether it's credible research or not, like there's peer-reviewed articles, and then there is garbage, quite frankly, that's uploaded to preprint servers or not very low tier journals that is like kind of bias confirming studies that are very methodologically, you know, poor. They're both kind of picked up by the media, depending on like so a good example is an article that came out a few weeks ago in a very low tier journal that basically said that the CDC was miscalculating the miscarriage rate of, you know, for vaccinated people. And the way they presented this analysis was to take out anybody from the denominator that was in their third trimester. So anybody so they had a miscarriage rate of like 90% or something, but this was in a research paper. So certain media outlets picked it up like, oh, some researchers are calling for a halt on vaccination in pregnant people. And this was like horrible, because we have a CDC health alert for pregnant people to get vaccinated because of their severe COVID risk, right? So this was just awful that this was proliferating. And then it hit, so as we go around this circle, we had the garbage article, and then we had the media picking it up, like, you know, not great media. It was like the Epic Times and things like that. But, you know, news outlets were picking it up. So it looked official. And then it was getting shared on the internet. So now I'm on the bottom of the circle. And then you saw people making TikTok videos about don't get vaccinated if you're pregnant. And this was like the worst case scenario, right? Because it started to go viral, this misinformation. So they have now retracted the article because the authors had, obviously done the analysis wrong, and it was not correct, and it was just a disaster. But the damage is already done, and this is intentional on these people's part because they know this is going to happen. So whether or not the article ever makes it into a peer-reviewed journal, it can still cause damage, and that's it causes chaos in an already bewildered public.
Thank you. That's excellent, just for people to have understanding about that cycle. I want to just end with asking you, well, I have a question, and then I have an ask for the audience and all of us, if you will. But, I found as a public health practitioner, it saddens me sometimes to think that it took a COVID pandemic response to get here. But a silver lining of COVID is that the layperson understands public health a little bit better, right? We still have ways to go, but I don't know how many conversations I've had with my home parents. What exactly what does that,
Yeah.
as a public health practitioner, right? So what's great is then we can also take lessons learned of COVID in our own practices and be able to apply them in future. So what is your goal in applying all that you've spent a ton of time on that's really gained traction here with your social media, your TikTok, all your project, to your post-pandemic world and work?
Yeah, so I don't think we're going anywhere with the misinformation about COVID, unfortunately. So as long as that is going on, I will be making videos about it and exposing the fallacies and kind of doing that. But I think misinformation as a public health problem is not going anywhere even after COVID. Like even before COVID, we had, certain thing, sunscreen causes cancer and not the sun, and like just crazy like things that haven't gone anywhere. People, the wellness community bringing in lots of, different kinds of supplements instead of getting vaccinated. That's not a new thing. So I think misinformation is definitely something I'm going to continue to focus on after COVID.
Great, thank you. I'm going to move to Randy, but I'm hoping that you can help me as a part of a Q&A, and then maybe take it, Dr. Wallace, to the open chat, and that we have regarding some popular, besides yours, social media accounts that we could follow where medical professionals debunk COVID myths and debunk misinformation, disinformation. If you could maybe tackle that and then share it with the whole group or with the whole audience on chat, I think that'd be really, really valuable.
Just name a couple of other accounts.
Yes.
Yeah, I can do that.
Thank you. Hi, Randy. Thanks for being with us today.
Absolutely. Thank you.
As general manager of NPR Illinois, explain to us how the role of NPR Illinois has had during the pandemic for Sangamon County community and its listeners, and how has that differed from its traditional responsibility as a public media station?
Well, like most of the local media, when a story this big comes out, we have to start figuring out how to harness our resources to cover it. And it's not something to go into deeply here, but the media has been changing as far as both digital disruption. We talked a lot about social media, but also about the business model. And so there are fewer reporters around to report on everything that's happening, which allows more disinformation, misinformation to get out. So what we did locally for Sangamon County is we got our reporters doing daily updates, and we're running those. They were the most read items on nprillinois.org at the early part of the pandemic, reading just the daily information that was coming from the Sangamon County folks and from the Illinois Department of Public Health. We also carried the governor's live press conferences so people could see unfiltered or hear unfiltered what was happening, what they were saying. So those were a couple of early things that were done. And then since I was looking back, there were more than 500 stories that we've written in the past since January of 20 on COVID. And so we try to continue to give people a way to understand what's going on and how to deal with it. It's been difficult because a lot of us didn't understand how a contagious disease, a viral disease worked. We've had to do a lot of learning in the community. And so that's our role to help out with, along with the science role. I think there's both media literacy that's needed and scientific literacy.
That's great, Randy. People's trust in news media has declined over the years, and Kaiser Family Foundation has found that, quote, no news media source garners the trust of a majority of the public when it comes to COVID-19 information, end quote. NPR Illinois has been a credible public media source for the public for a long time. How has NPR Illinois been challenged to reach people during the pandemic? And what has NPR Illinois implemented during the pandemic to overcome this?
Well, I mean, a couple of things immediately. Just like every other business, things were disrupted. Staff had to isolate. We couldn't necessarily go out and see sources. Sources were not necessarily right out there to be able to talk to. So you got used to using Zoom and getting your phone working and things like that that had to be done to make sure we could cover the story. I think also to be credible, we had to learn both in our local newsroom and using our national newsroom at NPR. We had to learn about how this works. Early on, I think the decision was made to allow the states to manage this individually. So that was a lot more information, 50 different departments around states or even counties at times putting out information. And it was a lot to sort through, not easy to figure out what is right. And so we are working to identify, like the folks here on this webinar, credible sources and making sure that we could reach out to them and get explainers. Dr. Wallace's TikTok stuff is fantastic in trying to help people understand some of the debates they hear. There's a lot of anecdotal things that came up that people will share on social media, and then to make sure that you compare that when it starts going around with empirical information to make sure that it's valid, it's credible. So all those things had to be changed at NPR Illinois to make sure we got to going. And I think other stations and print organizations made similar changes to get resources into COVID. Unfortunately, and I can see some of the questions that are coming in, the media is not absolutely pure. It's driven in many cases by profit. At the very least, we need an audience. And unfortunately, the way to appeal to an audience often is, as was discussed earlier, short headlines to keep people short attention span. We all have tons to do. How do we filter through all this stuff? And I think what happens is that we see a headline quickly on social media, and maybe we'll get a chance to click on it and go into depth and read really what's there. But a lot of time it's that headline that people are taking away. And so it becomes more critical to be careful about how you write a headline. And yet we have to write a headline that gets people to want to read it. So there's that balance that has to be managed.
Dr. Stewart mentioned at the beginning of this, my participation on our panel this morning for the Singham County Citizen Survey as a part of the Citizens Club. And, one of our main discussion points was around the question of trust in government or trust in elected and unelected officials here in Singham County, meaning that from the survey, the perceptions of the respondents was that there was greater influence or greater trust in non-elected officials. So, that kind of makes us think about trust in government a little bit here, even in Singham County. And so in the same vein of talking about trust in media, trust in government has been strained and before the pandemic and now during the pandemic. And given the strong relationships and support to ensure that NPR Illinois is telling the public all about State House reporting and what's happening as a part of legislative initiatives, how has NPR Illinois helped build back trust during this pandemic?
Well, again, it goes back to making sure we had the right sources, being transparent. So, occasionally something's going to get out that maybe not correct. We got to get out and correct it and let people know that this is updated information. This is, we might have been told at one point we didn't need to wear masks, and then all of a sudden we do need to wear masks. And it's been a very difficult story in that sense, in that it's confusing. There are new directives coming out Some are local, some are from another county, some are for other states. And is that us? Is that what applies to me as a member of the audience myself? It's been hard to keep it straight. And so, doing things like TikTok's restating where we're at with the current status of different things. Is it okay for an 11-year-old to get a vaccine yet? Yes, but you don't know what that answer is when there's so much noise out there. So what it comes back to the individual really, and the media organizations, to focus on literacy, media literacy, and get people to check your sources, try to make sure that that's the most updated story you can find. If somebody's sharing a story, or if you're about to share a story and it's from 2020, well, things have changed a ton already, and things have changed a ton since last week sometimes. So there's a lot of impetus for us to maintain trust and credibility, to make sure we're checking our work. But I think also what we've realized is that we have to help people learn how to do more media literacy and learn how to check their social media. Used to be we were the gatekeepers. Social media makes it so that everybody is their own gatekeeper. And if you decide to read something, you better check that it has some credibility.
Thank you so much for overviewing those recommendations. That's how I wanted to close it out exactly. So, but I do point everyone to, we have a partnered blog with the College of Public Affairs and Administration and the Center for State Policy and Leadership, where Randy just authored a blog post around misinformation and recommendations and identifying credible sources. So perhaps Randy can slip that in the chat for us as a link so the audience has that. But I thank you for that in reviewing those.
Sure, I'll be happy to do
and
that.
I also just wanted to say a shout out to Randy for he's really done a lot of work with Community Voices that really reinforces everything we just talked about, pulling in leadership, building trust, building credible information, understanding from leaders across the community on a various of topics. But he's also taken the opportunity to work with us with the Community Health Roundtable and these webinars to ensure that those can reach larger audiences too with Community Voices. So thanks so much for that work as well.
We're happy to do it, and it's been enlightening for us too. So it's good to listen to.
Thank you. Dr. Yarnell, thanks for being with us.
Hey, Molly, it's my pleasure.
If you could tell us a little bit about yourself and about your work as a pandemic health worker, and how did you help people in the community cope with COVID?
Sure. So the Office of Community Care with SIU School of Medicine responded to the COVID pandemic in partnership with Gail's team at the Department of Public Health by opening a COVID testing site at the Abundant Faith Church on the east side of Springfield, as well as our pandemic health worker program, which was through HFS. And that program specifically worked with individuals who were quarantined, who were told to stay home, and we provided them with essential supplies, food supplies, and support, as well as mental health support when necessary, so that they could, it would ease the burden of them being in quarantine, because we didn't want people out in the public when they had tested positive. And so that was one of the big focuses of my office on during the COVID pandemic. In general, this office focuses on public programs that support individuals who are generally underserved, underrepresented communities, and connect them with resources that are available. So we do everything from getting people Social Security cards to finding them permanent housing, helping them with job applications, connecting them with insurance, and one of the most important pieces is connecting people with primary care.
Wonderful, thank you. Did you encounter many people who relied on misinformation about COVID, and what kinds of misinformation have you heard in the community? And how did you overcome that in working with this wonderful program that you've activated in partnership with Gail's team?
Yeah, well, what we did, we took, our approach was really to listen to what people were saying and understand where the information was coming from. People that we work with tend to focus on what they consider their trusted sources. And so if they don't trust, as what Randy alluded to, and if they don't trust the media, or if they don't trust their physician, whatever it would be, they rely on the sources that they trust. So it might be their friends, it may be Facebook. Obviously they didn't just subscribe to Dr. Wallace's TikTok because that would be a good source of information. But they may rely on those sources of information. They may rely on their pastor. It depends on where they're getting the information from. So in their minds, it wasn't misinformation. It wasn't disinformation. It was good information from a trusted source. So we had to gain trust in the community with individuals so that we could also be a trusted source and then provide them with a different perspective, a more factual based perspective without overwhelming people with data and statistics. They didn't want to hear all that. They wanted to know that this was not going to, prevent them from getting pregnant, or, cause them to be microchipped, whatever it was, whatever the spectrum of concerns was. We wanted to make sure that we met them where they were and then tried to bring them to a point where they trusted that it was okay to be vaccinated, which, as we all know, it is.
Yeah, and it sounds to me, one of your main how-tos is building that relationship with the person and the individual, having the conversations, bringing in evidence, knowing there's different perspectives. But what else? The how, it's, oh, well, let's build trust, and that's not easy.
It's not easy, and the groups that we work with generally have a mistrust of the healthcare system for historical reasons, and maybe they were brought up that way. Maybe they know that there were experiments done in previous generations. The Tuskegee experiments are things that I've heard cited several times, and so they don't necessarily trust the medical community. And so our community workers are people who are generally from the communities in which they work, and so they're already in that community. And now they're providing a different type of information. They don't go out, they're not in white coats, they're not in scrubs, they're in street clothes, and they work within the churches, they work within community organizations, and they try to build that trust with individuals. And yes, you're right, it's very difficult. It's easy to say, oh, we're going to build trust with people. It takes months. It takes months with people to build them trust. It took 8 months to get one patient into a primary care visit from the time our community health worker initiated the relationship until the time they agreed to go to a primary care for the first time in 30 years. It took about 8 months. And so the relationships are very important, and they need to be fostered over a period of time.
So you've described to us an infiltration into the community, building trust. We've had work of mobile clinics, parish nurse type of programs. Chicago launched, I think they closed Chicago public schools one day and said, we're headed into neighborhoods, we're headed into homes for vaccinations. Have we done that in Singham County, and are we thinking about going into homes for vaccination of children?
So I would defer to Gail and Neil with that question. I do know that we've done campaigns around focusing on the Black community in Sangamon County and getting them vaccinated. It's important to meet people where they are and to let them know that the vaccine is for everyone. It's not for certain people of certain backgrounds or socioeconomic status. It's for everyone.
Yeah, should I comment, Molly?
Sure, go ahead.
Yes, I'm working with SIU on their diversity committee. There was a lot of media work done and advertising, plus with the workers and the ambassadors going out into the communities. Our staff was mortified to hear me. They didn't hear it the first time, which surprised me, but another time when I was doing a radio interview and they said, so you'll go to people's homes? I said, we'll go anywhere. We'll go to a house party. We'll go out in the community. And I was serious. Somebody was going, but we didn't get anybody, no takers really on that. So we did, do a lot of any place and every place that there was needed, especially when we had the National Guard team here to help us do that. Yeah. So we didn't get a lot of takers, and, so the offer was out there, and we meant it, sort of. We could have been overwhelmed, but we did want to meet people where they were and to provide the vaccine at any time. And we're still willing to do that. It's important that we continue to try to do those things.
Thank you. Dr. Yarnell, in your work, have you encountered people or families who've had problems with COVID or and hospitalized, perhaps even, worst case ICU? And what conversations have you had with them in your work that maybe they've changed their minds that perhaps could be something we could look at for COVID misinformation, perhaps even so much as sharing their stories? I know, unfortunately, I had someone reach to me, and I hope to if they're listening, I'm reaching to them after this as a really good opportunity. And I hope to connect with a couple of you later that reached to me around a personal story of another vaccine preventable disease, and, their desire and wanting to really share their story in an effort of helping with misinformation and vaccine uptake.
Yeah, and in fact, a really good story is one of our community health workers got COVID, and he was in the hospital for about 3 weeks, and he swears that he was closer to death than he'd ever like to be at his relatively young age. And so he turned into one of our biggest vaccine proponents. And so he's well ingrained in the community. And so he was just an advocate from the time the vaccines came out, was one of the first people, kind of made sure that his social medias were updated with him getting the vaccine, and he shared his vaccine photo with people and told them, it's okay, I got this. You trust me, you've known me for 20 years. I had COVID. I don't ever want to get this. I don't want you to get this. I don't want you to have to go to the hospital, get the vaccine. And so that was really powerful. He was a significant advocate on our behalf and the vaccine's behalf. Other than that, I mean, we've seen plenty of people with COVID, and it's changed some minds and it hasn't changed others. And so with people citing again the antibodies, and now they know that they don't need the vaccine, right? I should say they know that they don't need the vaccine because they have the antibodies, and so they, even without antibody testing, but they said they've had it, now they don't need it, or they say or they've had it and now they really want to get it. Right.
Thank you for that. And if Brandy and Dr. Wallace can rejoin too, we have a question in from today around and from the audience and prior for us to think about politics involved with COVID and our response to politics and how we reduce political intensity surrounding the vaccine. Last month's webinar shared Brookings' report about the reduction of the space between disparate populations and vaccine and the widening of partisanship around vaccine. So if you could discuss what can we do to reduce the political intensity around vaccine? And then Dr. Wallace, I know more specifically for you then, how can we respond to the objection of some are making to mandating the vaccine and mandated policies because you can still catch and spread COVID? Sorry, Dr. Wallace, you're muted.
Sorry. So the idea that the vaccine is being forced upon people is just not true. You can still decide not to be vaccinated. Nobody's going to come to your home and force you to take it. Part of being in public during a pandemic is to protect those around you. And if that means needing to get a vaccine to do certain jobs, then that's what it means. And people need to accept that there are consequences with every decision that you make in your life. And that's just one of them that's going on now during a pandemic. So if a healthcare worker is around vulnerable patients, then they should be vaccinated to protect those patients. We have data showing from the CDC that you are 6.1 times less likely to have a COVID case in the first place. And you can't, if you're vaccinated, and you can't pass on a disease that you don't have. So this idea that vaccinated people are these super spreaders walking around the community is just not true. Can vaccinated people get COVID during areas and times of high transmission? Yes, and that's why we're having these booster discussions and other things. But the idea that we're mandating a vaccine that doesn't work and that vaccinated people are super spreaders is just not, it's just not true.
Yeah, when I think about the political aspect of all this, it happens in World War II, there was propaganda, there was communist propaganda for years. All sides use information. It can be powerful and it can be negative. And we've reached with social media and a 24/7 news cycle, this era, where everything eventually is weaponized. And so in the early days of COVID, I think everybody wanted to figure out what was going on and get people healthy and do the right thing. But as time goes on, we get to figure out how to call it an estate tax or a death tax or whatever it is that we're going to do. And that works for both sides in different ways. I think anti-vaxxers is being used as a pejorative term from one side of the aisle. And that's coming up both ways. If you're wearing a mask, you're considered liberal, and that's not really what's going on. But those things sink in and create an atmosphere with all the changing information that medical professionals and scientists need to get out to us. The misinformation we're talking about is so hard to digest as an audience member. And so what can we do? Again, do our very best not to share things that we don't know are credible. Do our very best to, if we're not sure, do some research. And I know it's hard to find time sometimes, but then it's probably better not to share. And as much as you might have had the experience, that may not be the empirical, experience that's going to happen. So what we can do is continue to hope that everybody will listen and work toward resolving this.
And I do think there's a culture of kind of toxic individualism that certain political figures are fueling to kind of invigorate their base, which is having a detrimental effect on public health. Like my liberty is being taken away, and in kind of that personal freedom issue kind of needs to take a back seat to the public health when we are in a pandemic. And that's what I think is being lost somewhere. And, then misinformation and all the rest of it.
Dr. Yonel or Gail, we're really at time, kind of over now. Do you have any last reactions, either to that question or help close us out?
This was very helpful to me. I learned a lot of things as well, and we're not done. Unfortunately, we're not done, so we're going to have to watch our communication even closer, because it's just the longer it goes, it's old news, and we're going to have to get people's attention in some other way. But I appreciate meeting with all of you and learning all this.
Well, thank you so much, all of you, for being with us this afternoon, your time and all your really expertise that you brought for the conversation today. I know there's several Q&A that, some are quite lengthy and really deserved more of our attention that we can provide as a reflection. And those are logged. So I do plan to work with the panelists following this webinar to make sure that we give you an answer that you deserve as a part of submitting a question and being an audience member. So know that we'll be taking care of that. And I just thanks again for the opportunity to moderate and be as a part of this webinar. So Dr. Stewart, I'm going to hand it back to you to close out.
Sure. Thanks, Molly. I agree with you. What a great session we've had today. And thanks to our panelists and to you for moderating, and for the panelists for the wonderful information that we all heard. I'd also like to thank our technical support folks, Cody Pope and Rob Kerr, for making these sessions work as well as they do. And to the originator of this series of webinars, Bruce Sommer from UIS, who started a general series of COVID-related pandemic webinars back in March of 2020, right at the beginning, and had many of them, and we joined in then in June. And so we are going to take a break in December, and we'll be back on January 21st, topic to be determined depending on how the pandemic's going. And I'd like to wish all of you, on behalf of UIS and the Community Health Roundtable, wish everybody a very pleasant holiday time with your family and friends. Please stay safe and happy and healthy. And thanks again to our panel, or our participants, people who signed into the webinar, for joining us today. You're the real reason that we think these are important sessions to provide. So thanks, everybody, and we'll see you again in January.
Thank you. Bye.